Okay.
As the Vice Chair of the SAU 21 Joint Board Policy Committee, I find that due to the state of emergency declared by the Governor as a result of the COVID-19 pandemic and in accordance with the Governor's Emergency Order Number 12 pursuant to Executive Order 2020-04, this public body is authorized to meet electronically. Please note that there is no physical location to observe and listen contemporaneously to this meeting, which was authorized pursuant to the Governor's Emergency Order. However, in accordance with the emergency order, I am confirming that we are A, providing public access to the meeting by telephone with additional access possibilities by video and other electronic means. We are utilizing Zoom for this electronic meeting. All members of the SAU 21 Joint School Board Policy Committee have the ability to communicate contemporaneously during this meeting through this platform, and the public has access to contemporaneously. Why do I have to say it 8 times? Listen, and if necessary, participate in this meeting through dialing the following phone number: 646-876-9923 and webinar ID 872-9942-5093, or by clicking on the following website address listed on the agenda: https://uso2web.zoom.us/j/872-9942-5093. Providing public notice of the necessary information for accessing the meeting. We previously gave notice to the public of the necessary information for accessing the meeting, including how to access the meeting through using Zoom or telephonically. Instructions have also been provided on the website of the SAU 21 office at www.sau21.org. Providing a mechanism for the public to alert the public body during the meeting if there are problems with access. If anyone has a problem, please call 603-926-8992, extension 103, or email at revans@sau21.org. Adjourning the meeting if the public is unable to access the meeting. In the event that the public is unable to access the meeting will be adjourned and rescheduled. Please note that all votes that are taken during this meeting shall be done by roll call vote. Let's start the meeting by taking a roll call attendance. When each member states their presence, please also state whether there is anyone in the room with you during the meeting, which is required under the right to know law. Rhonda.
Sharon Gordon.
I'm here, and my kids are here as well.
Leslie LaFond.
Yeah.
Mike Rabideau.
Here, one other person.
Tom Bonjess.
Present, alone, and wondering if Leslie is alone or not.
Oh, sorry. Yes, alone.
Greg Parrish.
Present, family in and out.
Okay, I have the roll call taken.
Let me get to the agenda. Okay, so our first one is policy AC.
We have the minutes to
Oh,
approve.
sorry.
That's okay.
Yep, so we have minutes first. So anybody have anything on the minutes from the board meeting in June? If not, I'll entertain a motion.
I'd like to make a
can't
motion
because
to
I'm not
approve the
there.
minutes of June 24.
I'll second that.
Are we ready for the vote or any discussion?
Any discussion? No, go ahead. Vote.
Greg Parrish.
I'll abstain.
Tom Bonjess.
Yes.
Mike Rabideau.
Yes,
Leslie LaFond.
Abstain.
And Sharon Gordon.
I'll need to abstain as well.
Okay, I have that vote taken.
Thank you. Policies required by law, correct?
Yes.
So our first one to discuss is A, Code AC, non-discrimination, equal opportunity employment, and district anti-discrimination plan. Anybody have any discussions or concerns or questions they have on this?
I just have one question. On the second page, item D, the district anti-discrimination plan. Now that's just every 2 years. It's not, this is set by the state for every 2 years.
So this policy and ACAC are the two I've been alluding to for a number of months now that are required by the changes in the federal Title IX rules. These were rules that were revised by the Department of Education and were put into place right at the beginning of the pandemic for implementation as of August 19th. And so what MASC, boy, oh boy, what New Hampshire School Boards Association has done, sorry about that. What New Hampshire School Boards Association has done here is taken that and got to us near the end of the summer, a revised policy to handle these discrimination, sexual harassment and discrimination issues under that new federal set of rules. And so, yeah, Mike, pretty much what you're seeing here is baked into those rules. It's a strange one in that one of the other things that NHSBA has said here, I think you may have seen the comment, they're recommending that school boards adopt these as is, knowing that they're probably going to come back to making revisions as there's a better understanding of the regs. Regs are usually not put into place this quickly. So they believe this covers our district and their districts in New Hampshire under the federal law, and that they're going to then revisit some of these things. But yes, something like that, the requirement that you revisit it every X amount of time, what investigations look like, all of those different aspects of this are all required under the federal law.
Thank you.
And just for the record, you guys had already approved this. This was adopted in March. The only change to this from the adoption is on page 3. We highlighted it for you. And that's because of the policy change to ACAC that you're going to look at next.
Yeah, I'm sorry. I used that opportunity to go right into ACAC. So, right. Thank you, Rhonda.
You're welcome.
Bill, it's Greg. If we have language in this that references what the state is doing with any updates, doesn't that preclude us from having to review this on an ongoing basis or more regular basis or not?
I don't know if what the requirement here was to review this policy as much as it was to review your plan.
Okay. Okay, that's fine. That answers it then. Thank you.
Yeah.
Any further questions? All right, you want to move on to the ACAC?
Do we want to
Make a motion to approve
You wanna make a-
policy.
Thank you, Tom.
We have to approve that one first or not?
Yes, thank you.
Yeah,
Okay.
I'd like to make a motion to approve policy ACAC forward to each school board for first read.
I'll second it.
Greg Parrish,
Yes.
Tom Bonjess,
Yes,
Mike Rabideau,
Yes,
Leslie LaFawn,
Yes,
and Sharon Gordon.
Yes.
I have that vote recorded.
thank you. On to ACAC.
Right, and this is most of what I was talking about under the last one, that really spells out the rules under this new federal law. Any questions on this? It's really heavy on procedure, which you don't see in a lot of policies, but is really required in the case of this one, and really changes the way these investigations are done. It's going to require us to do some modification of roles and who are decision makers versus who are investigators versus who's our Title IX coordinator, those kinds of pieces.
I do have a question, Bill. So they're implementing this. Are we looking at added staff to do this, or is this something that can be done by someone who's already here?
It's a good question. It can be done. It will require some people who haven't necessarily traditionally been involved in these pieces. Caroline, you may want to jump in here and talk about how we're sort of viewing the architecture of this work. But it may require some additional people having this training in investigating or making decisions or those kinds of things.
That's right. So it will, depending on the reports or the complaints, it could involve people at different buildings. So, and it's new because there are different different roles of people for the process to investigate and then to make decisions. And those are outside of the actual coordinator. And then there's the whole grievance process, which would be outside of the coordinator and go and involve the superintendent. And so there's a reason why this one is 21 pages long. It has all the definitions in there, the roles, training required, the differences between the reports and formal complaints, and then the whole grievance process. We began the training process just last month, actually.
I'd like to make a motion to move policy ACAC forward to each school board for the first read.
I'll second.
Any further discussion? Having none, we'll do a roll call.
Greg Parrish,
Yes.
Tom Von Jess,
Yes.
Mike Rabideau,
Yes,
Leslie LaFawn,
Yes,
and Sharon Gordon.
Yes.
I have that vote recorded.
thank you. Our next one is DGA, which is the authorized signatures.
Yeah, you're going to see some examples in the policies being brought tonight of some things that NHSBA went back and looked at since the pandemic. One of them was the need for districts to be able to do authorized signatures electronically and some other kinds of beefing up around those rules. You have this one. I think there's a second one in here as well around signatures and authorizations. But this is, I think Rhonda's included the adoption dates. Yeah, when we
Right.
previously looked at this policy, but it's an attempt to standardize a legally required policy for each of our districts and to make sure we all have electronic signing capability within policy.
And these policies are also referenced in the DAF grant policy that we just are in the process of approving as a second read at boards right now.
Thank you, Rhonda.
Any questions?
So I have one quick question on DGA. I don't, maybe I read it wrong. I didn't see any updates or changes or electronic signature information in this. Am
I don't know if your policy was the most recent, I think, in this list updated. I don't know if that last sentence that actually authorizes electronic signatures is in there or not. It wasn't in some of them.
So that last sentence, electronic signatures may be used in accordance with board policy. Gotcha. Roger. Okay, great.
Thanks.
Any other questions?
Bill, Greg, would this fall into any of our audits that we do annually? Because now that we are doing these electronic signatures, and now we're going to adopt this policy, does that become part of our audit?
Can you give me a little bit more on it? Allows for the use of electronic signatures. We've been using them internally. There's also another policy we're going to look at where we used some electronic signatures for IEPs, those kinds of things. If your question is, does this policy allow us to do some signing of documents that boards do? I think the answer would be yes.
Okay. Well, I know that we have only so much time to sign manifest payrolls, things like that. That's part of the audit process. Is this tied back into that, or is this just completely different that allows us to go ahead and use the electronic signature?
I don't think it's tied specifically to that. This allows for the use of electronic signature.
Okay.
Greg, again, this policy is referenced in the DAF policy regarding the
Okay.
federal funds. And so that's part of the need to have this updated. And was, I think, in everybody's audit was our policies were so out of date that bringing
Okay.
this up to date is going to fulfill some of those requirements.
It'll take care of that. Okay, thank you.
Rhonda, that's a good point that you just raised that I completely forgot. You and I have been through these so many times in the last few weeks. We characterized this meeting at one point as the down the rabbit hole meeting. There were a number of policies that we had to do at this meeting because they're required by law, and NHSBA has given us new versions of them, et cetera. You're going to see in a number of these other policies, as we started through those policies, many of them refer to other policies. And what we found is that our policies in those areas, even though some of them were only recommended, they were mentioned in required by law policies, and they were not up to date.
Yeah.
So we went chasing them down the rabbit hole.
So I'd like to make a motion to approve policy DGA forward to each school board for a first read.
I have a second.
Second.
Any further discussion? Roll call, please.
Greg Parrish,
Yes.
Tom Von Jess,
Yes.
Mike Rabideau,
Yes.
Leslie LaFawn,
Yes.
and Sharon Gordon.
Yes.
I have that vote recorded.
Thank you. Our next one is policy DK, which is payments, checks, and manifests.
Rhonda, do you want to speak to this one?
Payments, checks, and manifests.
Oh, I'm sorry. I thought you had.
Yeah. Let me open it up and look at it. First off, this again is another policy that was referred to in DAF, and it even says that on the front page of this policy. You know, 3 boards have a version of this policy that is quite old. I think 15 years is the most recent one, and 2 boards don't even have this policy at all. But knowing that it's required as part of the required by law policy, and this policy in itself is required by law. So we thought it was a good idea to bring it forward to you.
I agree with that. Roger all.
I had a question on this one, wondering if in the second paragraph with activity funds will require the signature payments drawn on activity funds, building principal, can it say or designee? I know when I was an assistant principal, I was on the accounts too and I could sign, and there's a benefit to that, which we've talked about doing here, but I don't know how you feel about that. Just in terms of if the principal's not available, can the assistant principal sign if they're on the bank account, which often they are.
So usually when they allow designee, they give us language that says or designee.
Okay.
I mean, we can certainly check it if this board wants to authorize it, allowing us to go back and sort of check on that. But my sense is, Aaron, that if it doesn't say or designee here, it probably is specified this way in the law.
Okay. And I know activity funds are tricky, but okay. I was just curious.
Yeah, so activity funds are tricky, and I think you bring up a good point, especially if someone were out for any length of time.
Right.
A disability or any COVID, right? Who knows? Hell knows why.
Right.
So I think I don't want to gum the works up here, but I think it might be worth asking the New Hampshire School Board Association if we can add designee in here.
We can, if you want to authorize it that way, we can do that. I'll say in the situation that if it was any length of time that somebody was going to be out, we'd name the assistant as the acting principal, and the policy would cover them. But we can check that absolutely. And if we can add it, we'll add it.
Well, like I said, I'm not trying to gum things up. If there's another mechanism to do it, that's great. I'm just also thinking about it is sticky, and I've seen districts that have had problems with activity funds.
Yes. there are some interesting, yes.
So I think tight controls is good. So I agree with that. I'm okay with tight controls being 2. Like I said, I'm not trying to gum things up. And if there's, Bill, if you say that there's a way around this, because if someone was out for a length of time, more than a week or whatever, we'd appoint the assistant principal as principal, and that works, then I'm okay with that. Otherwise, I think we might want to ask.
Tom, do you have an assistant or principal there at Northampton?
Yes, do you?
No, we do not.
Yeah. You should think.
So that being said, is this designee, would that be assigned by you, Dr. Lupini, as the superintendent, or recommended and then the board approve?
I think it's a reason for keeping this tight. I sometimes when that ends up in language, you end up with 2 people doing signatures, and the purpose here is related to all these cases that some of us are kind of alluding to here, where the controls are not real tight. If someone were out and given this policy and it would be required, then the superintendent and or the board would designate that person.
Okay. And then I'm good moving it forward as is, but I think, Aaron, that was a great question.
Yeah, I would agree with that.
Any other discussion?
No, but I'll make a motion to move policy DK forward to each school board for a first read.
I'll second.
Any further discussion? Roll call, please.
Sharon Gordon,
Yes.
Leslie LaFawn,
Yes.
Mike Rabideau,
Yes.
Tom Bunges,
Yes.
and Greg Parrish.
Yes.
I have that vote recorded.
Thank you. Our next one is policy JLC, student health services and school nurses. I'm assuming Caroline is going to discuss that one. Or no, or is it you, Bill?
No, that's fine. Yeah, let me just say that before I turn over to Caroline, you have a number of policies here that are medical in nature. Makes sense. Again, people going back and reviewed those at NHSBA in terms of the time that we're in. And what we've done on top of receiving these from NHSBA is that Caroline and I met with two of our nurses. We sort of work with them as leads, if you will. One at the elementary, one at the high school, and went over all these policies to make sure not only had they been signed off by the State Nurses Association, which many of them had, but that our people were comfortable with what we were recommending to you. So every one of these that you see that's of a medical nature, we've reviewed with the nurses as well. So Caroline, sure, do you want to say a word about this one?
This one reflects the new requirement for school nurses to have a bachelor's degree. So that's one notable change. And roles and responsibilities, and that things need to be reported to nurses. This one is very straightforward.
This policy was just adopted by all of the boards on January 21st. And then they come out with the revision. It's in the content area of the change of the requirement. So that's the only change to this one since you just looked at it.
And the revision was what Caroline just talked about in terms of the change in requirements for nurses.
So does this mean they must have their licenses prior to being hired, or can they be in the middle of getting their license?
So they need to have their license, but they can be in the middle of their bachelor's degree.
Okay.
So you can have an LPN and he or she's getting their bachelor's degree, and that's okay as long as they get it. Or you can have an RN who's got their bachelor's out of the gate, good to go.
Okay.
I'd like to make a motion to move policy JLC forward to each school board for a first read.
I'll second either one. Any questions? I mean, any further discussion? All right, roll call, please.
Greg Parrish,
Yes.
Tom Bunges,
Yes.
Mike Rabideau,
Yes.
Leslie LaFawn,
Yes.
and Sharon Gordon.
Yes.
I have that vote recorded.
Thank you.
Now that with required by law, just one quick comment. I'm going to defer on making any more motions.
Well, chicken. Okay. Then we'll do rock, paper, scissors to see who has to, okay? All right. Okay, so we're into other policies. ACB equity.
Yeah, so this policy really comes out of the beginnings of the work that we've started to do. It's not an NHSBA policy, but it is a policy we've seen in some other places and certainly in some other states that really speaks to us being a district that values the inclusion of all students, all points of view, and make sure that resource allocation, creation of programs, those kinds of things is done with everyone in mind. I've heard many of my colleagues talk about these kinds of policies, this policy, I guess in particular, as aspirational. I think that's a good way to sort of lay it out of what we strive to do in terms of making sure that all voices are heard, that all of our students see themselves in our curriculum. Those things that quite frankly, we've been talking about for some time, but we've probably talked about more over the last number of months. Caroline, I don't know if you want to say a word about this as well.
I'm sorry. I didn't
There's
mean to-
a lot of, no, it's hard to know where to start. There's so many layers to it, and so many people have come forward as expressing this is a value and a priority. Students, alumni, teachers, administrators, and this policy is great because it talks about representation and curriculum and other policies and professional development for staff. So it's something that there's people have expressed a desire for this to be represented in policy formally.
I will tell you from other districts where I've worked and where equity policies have taken place, it's a really powerful message for staff, as Caroline has just said, for parents, for students, to see a set of beliefs like this laid out by the district. So we're did a lot of work on researching this, had a lot of input from different groups on this, and are really pleased to recommend this.
I think it's wonderful, and I think it because it's another layer to what our philosophy is on our schools. You know, each one of our schools has that, and we've built on it. And now it's one thing to have that as our school vision or whatnot, and that's great when you go and you look at it. But to have it as a policy, I love that. So go ahead, Tom.
So I support this 100%. I just have two quick questions, and Dr. Lupine, I think you just alluded to one of them. The first is a curiosity question. Who participated in the drafting of this policy?
So it started out from some other districts that have done a lot of equity work from the NHSAA equity conference last year. And I see Donna's on here. So Donna was one of the people. We shared this with a group of students that came, mainly graduates who came together during the summer, who had come to us interested in equity work. There were a number of other faculty members, particularly from the high school, that were involved in these discussions.
Okay, thank you. And my second question is, have members of SESPA-C and really each of the districts, the teachers at each district and EAs in each district had a chance to review this? Are they kind of on board with this, or will this be a surprise to them?
No, we talked with principals about it, and I can't remember whether I did with CESPA, but certainly C leadership, and they are 100% on board with this.
Gotcha. As am I. I just wanted to make sure
Yes.
that I knew what I'm signing off on. Okay.
Those are great questions. Thanks, Tom.
Any other questions or concerns? Anybody would like to make a motion?
I'll make hold on. I'll make a motion. Hold on, I'm back. Where am I? Okay. Sorry, I keep bouncing around here. My apologies. Motion to move policy ACB forward to each school board for first read.
I'll second that. Thanks, Greg.
Awesome. Any further discussion? Then I'll ask for a roll call, please.
Sharon Gordon,
Yes.
Leslie LaFond,
Yes,
Mike
absolutely.
Rabideau,
Yes.
Tom Von Jess,
Yes.
and Greg Parrish.
Yes.
Yeah, roll call taken.
That's awesome, guys. I hope that we all get it to our other boards and get it on there as quick as possible. Our next one is BEA, regular board meetings.
All right, from the really aspirational to the mundane. So there's a couple policies here that just haven't been looked at in some time. Again, these are ones that we were led to by running down the rabbit hole in terms of board meetings. And Rhonda, I can't remember whether there were other particular pieces to this or not.
This one was on everybody's agenda in October. We realized whenever we were going to do the in-person meetings, we had to pull out everybody's existing policy, and we realized how old and outdated, again, they were. And when we looked at what the NHSBA policy is, it's, everybody's individual policies were all over the place. This at least kind of streamlines it a little bit without, removing any identities from each of the schools. It still allows that, but it's just a little more to the point. And it is a recommended policy by NHSBA.
Thanks, Ron.
Any further discussion?
Does this mean we only have to meet every other month?
Yes.
No, it's once a year.
Uh,
Fine print.
right.
Yeah, the existing policies that you guys had, I mean, it's still listed, dates and times from
Days of the
years
week.
ago.
Days of the week. Oh my God.
Leslie, you looking for a motion?
Yes, please.
I'll make that motion to present this to all of the boards for policy BEA.
I'll second it. No, actually, somebody else second it.
I'll second. Thanks, Mike.
Yeah, and my computer has froze. So any further discussion? If not, well, let's go to roll call.
Greg Parrish,
Yes.
Tom Bonjess,
Yes.
Mike Rabideau,
Yes,
Leslie LaFawn,
Yes.
and Sharon Gordon.
Yes.
I have that vote recorded.
Thank you, Rhonda. Next one is BEB, emergency board meetings.
Rhonda, I'll let you speak to this one if you want.
This again is, I can almost just repeat what I said with the first one. Everybody was all over the place with their existing policies as well as the age of their existing policies. This is a little more, appropriate and streamlined for everybody without removing anybody's individuality for their boards. And NHSBA revision was 2012 versus yours, which I will not bring up the age of.
I have a question on this one. The only thing it states is that in the event of an emergency meeting, the board shall post notice of time and place as soon as possible. There's no 24-hour or 48-hour.
That's the law for an emergency meeting.
Right.
Oh, okay.
Right. It still has the legal reference in there. And so whatever that legal reference is, as far as the RSA, you still have to abide by that.
Okay, so as long as we label emergency meeting, we're good for everything.
Yes.
Yeah,
believe-
if a district somewhere, if somebody in the general public thought a district was abusing that, they were having emergency meetings like every week. My sense is, you'd face some problems with that, but generally speaking, if there's really an emergency and you can make the case that there's an emergency, yes, you can do that.
In the last sentence of this, it indicates something about the minutes stating clearly the need and purpose of the emergency meeting. Does that
Yeah.
indicate or mean a statement prior to the meeting needs to be made if it's an emergency meeting? Or is it just?
It's the minutes. And whenever you guys do an emergency meeting, we always list in the minutes the purpose of the meeting. So.
Okay. So it's not like our current meetings, like we have to read our one-page document. It's just that it already takes place.
Right.
Okay.
Anybody want to make a motion?
I'll make a motion to move policy BEB4 to each school board for first read.
I hear a second.
I second.
Sweet. Thank you. Any further discussion?
I'm
Seeing
just going to let you guys know real quick. I'm looking at section 91A2 that's referenced, and I believe it does say in here there is still the 24-hour notice. So,
Okay.
Just an FYI, I know there was a question on that.
Okay.
So I can't call you at 4 o'clock and say, let's go have a dinner at 6. All right, fine.
I don't think, unless I misread that, because I did skim it very fast.
No problem. Thanks, Rhonda. I appreciate it.
Greg Parrish,
Yes.
Tom Bonjess,
Yes.
Mike Rabideau,
Yes,
Leslie LaFawn,
Yes.
and Sharon Gordon.
Yes.
I have that vote recorded.
Super. Thanks. Our next one is BEDC quorum.
So Rhonda, I think the issue on this one, because of the age of them, is that it doesn't include the present policies don't include the allowance that's part of the law for people to participate remotely.
Yeah,
right?
this was revised in 2017. And it conforms to new legislative amendment under the right to know request or the right to know
There was-
law. That was why this was updated.
Right,
And,
there were some changes made to that remote participation,
Right.
right?
right. And again,
But do our present policies even allow for remote participation, even though the law does?
I think I want to say it, I thought it did because I could have
Yeah.
sworn a couple of years ago, we had somebody call into one.
Okay,
Yeah.
well, we do it.
We still-
We do it.
Yeah.
Yeah, we do it.
right. I believe we've asked that before and
Yeah.
you're allowed, if you have a majority of people calling in under normal conditions, that's not permitted.
Right.
But like if you have one or two people, and just like we do in this forum, they have to state, where they're, if anybody else is in the room.
Right.
Yeah, because Rhonda, didn't we have it when Fran was out? Like, remember when she had her foot or something? I swear
Yeah,
she or somebody else called in for a couple of meetings because they couldn't come.
right.
But
Yeah.
you probably still had a quorum, Leslie. You probably had a quorum live in one place, non-emergency, and then you had
Right.
one more person calling in or two people calling in electronically.
Gotcha. Okay, you're right. Thanks, Tom. Okay, any other questions on this one?
Yeah, I have a question. I'm trying to read through it and on number 1, it says the reason for not reasonably practical for the member. So in other words, if we have an in-person meeting, you have someone from the outside coming in, you actually have to state why you're doing it electronically?
Yes, you have to say why you have to participate remotely, yes.
So it has to be documented in the meeting minutes then. Got it. Okay, thanks.
Well, I would suggest not stating you're having a bad hair day is what I would say.
Just leave the video off.
Yeah, I'm not sure that would pass legal muster, so.
I don't think it
agree.
would.
I agree with Leslie.
All right.
This is for creating a quorum. It's not an outside speaker, Mike, right?
That's right.
I do think that number 5 is weirdly repetitive and I've read it like 100 times trying to figure out if they both sentences need to be there, but it seems like it doesn't. So I don't know if someone else can chime in, but it seems like that second sentence is just repeating the first.
Except in an emergency, the members participating electronically from remote.
And maybe I'm just being too picky, sorry, but
And I honestly feel like we've talked about this, but now that you're saying it, I'm like, what was the reasoning? Because
it's saying the same thing, right? I don't see what the second part needs to satisfy that's not in the first part.
I don't recall what we.
They're not part of the quorum if they're participating from home. That's
Right.
pretty clear in the first part. Just my 2 cents. And all of my notes are done, so I have nothing left to say.
I think I interpret this as saying that to Tom's point, if you have a quorum physically, they can participate, but the second sentence says that they can participate. They're just not going to be allowed to count towards satisfying the quorum.
Well said, Greg.
Except in the emergency, yeah.
Okay, but I have an issue with that because your number on the quorum is your voting number, correct?
No, everybody can vote.
No,
If they're a member of the meeting, they can still vote.
Oh, got it. Okay.
I think this, Mike, I think this just states that you've got to have a physical quorum at the location.
Correct.
Got it. Okay, great. Thanks.
And you couldn't vote if there wasn't a quorum, right?
Correct.
Right.
Any further questions, concerns? All
I'll
right,
make a motion to forward to all the boards the BEDC quorum policy.
I'll second.
thank you. Roll call, please. Oh, no, further discussion? Hearing none, can I have a roll call, please?
Sharon Gordon,
Yes.
Leslie LaFawn,
Yes.
Mike Rabideau,
Yes.
Tom Bonjess,
Yes.
and Greg Parrish.
Yes.
I have the vote recorded.
Great, thank you. Our next one is BEDH, public comment and participation at board meetings. Anybody have any comments or concerns on this one?
So as you can see, the policies that you have in place are rather dated. I forget how recent this revision from NHSBA is, Rhonda, but
This is September 2018. And this got brought up whenever Barrett and Will were doing the workshops with everybody. And they were pointing these policies out. And when I started looking at everybody's individual policy, I realized that they were very outdated, as you can see in the information we provided in the administrative content. And knowing the NHSBA updated them in 2018, we just thought it was in your best interest to update your policies.
Thank you.
Okay, I have a few questions in this one. Okay, so given that these are the rules of order, are they to be stated prior to the beginning of the public comment section?
it'd be included in the agenda.
In each of your agendas, whenever you look at the public comment, all of that is in there. And so they're
Okay.
posted that way. So that stuff is always available for the public to have access to.
Now, can this be overridden by just the chair, or does it have to be majority if you want to extend the public comment time?
I think it says, doesn't it say, or the majority of the board?
Majority vote of the board.
Yeah.
Oh, okay, I missed that. Okay, thanks.
Yep. Any other questions, comments? Hearing none. Oh, jeez. I just walked out. All right, can I hear a motion?
I'll make a motion to move policy
BEDH?
EEDH forward to each school board for school district for first read.
I'll second.
Thank you. Any other comments? All right, a roll call, please.
Greg Parrish,
Yes.
Tom Von Jess,
Yes.
Mike Rabideau,
Yes,
Leslie LaFond,
Yes.
and Sharon Gordon.
Yes.
I have that vote recorded.
Thank you. Next one is EBBB, accident reports.
Dr. Killian, you want to speak to accident reports, which was another one of those policies that we reviewed with the nurses? And by the way, with our business office, because Nancy's the person who handles the intake of those in our office.
Sure. This formalizes this, and I'm seeing that this policy didn't exist in one district and was not reviewed for a long time in other districts. So basically, how to report when there's an accident, what a student, what an employee needs to do, how they involve the nurse, how they notify the SAU and the parent. And then this last piece is not to, even though it's short, D, the training, that's something that we need to put in place in our districts. It can be simple as notifying people how to report accidents and follow the process, but that's something that needs to happen every year. The nurses cited the bloodborne pathogen training, that's part of it. They have to express how to use universal precautions when there are accidents. This is an important policy. They really like this one a lot.
So I've got a quick question, and I've got no issue with this, and this is just me getting my head around how all this policy stuff works. Is this one for students, and is there another one for staff? Like, because we should have to report any accident, right? Not.
Yes, I
So-
believe this would be for both.
An E category, as I recall, an E category, Rhonda, is for both.
Yes,
Yes.
yeah.
All right.
And on,
it states that.
you're muted, Mike. I think Mike was saying that it states that right on page 1.
I have a question. I have a question about the general accident reporting. Whenever an accident occurs in school, on a playground, etc., is there a time frame? Is it during school hours? I mean, what if a child is on the playground within a half hour after school ends and they get hurt, does that fall into another category, or are they still considered in school?
These are generally considered during school time, Greg. If it happened half an hour out and the nurse was still there and somehow the nurse ended up involved, my guess is they'd file an accident report, but this is generally having to do with school hours.
Okay.
And witnessed, right? And that's the other thing. If a kid falls in the playground and nobody sees it, did they really fall?
Second page, the second page actually clarifies Greg's comment, because it says, number B, it says serious injury which occurs during the school day or on school property. It doesn't give any time frame. So
If it's a school activity, we get reports in here, you know, it may have been maybe a practice that was taking place after school, something happened. We do see those reports and get those
Right.
frequently.
Right.
Or field trip.
Field trips,
Field
yeah,
trip.
anything that's seen by the school.
I would make a comment, but then I'd be held against it. So, all right. Any other
Recording.
questions? So like if I push somebody down the stairs and
We're
nobody's
recording.
right? Right?
We'd have to write a report.
Leslie, would you like a motion, Leslie?
Yes, please, Mike,
Well,
please.
wait, hold on. Before you make that, Mike, I guess I have another question regarding the liability of the buildings. Again, back to my after-school incident. How liable are we with not reporting or reporting under this particular policy, the way it's written?
Any
Liable.
accident gets
They
reported.
have to report it.
Yeah.
Okay. Okay.
Yeah, because the first thing Nancy does, for example, with those reports is always makes our insurance carrier aware,
Right.
Yeah.
who helps us with what steps we may have to take. I mean, that's a sort of a first step of her function in this.
Okay.
So those reports are important, but again, they can only know about them if it's something on the weekend. It's not brought to our tent, right? That's harder. They don't know.
Right. And that actually specifies there's a 24-hour window there.
Right.
Right. Okay.
Okay. Any other questions or concerns? Then Mike, give me a motion.
I'll make a motion to present to the school board's sample policy EBBB for consideration.
Can I have a second?
I'll second.
Thank you. Any other further discussion? All right, roll call, please.
Greg Parrish,
Yes.
Tom Von Jess,
Yes.
Mike Rabideau,
Yes.
Leslie LaFawn,
Yes,
and Sharon Gordon.
Yes.
I have that vote recorded.
thank you. Our next one is EBCF, Pandemic and Epidemic Emergencies. This is not appropriate, so maybe we should just skip it.
Yeah.
Oh, you're on a roll tonight.
Oh, it's late. It's been a long day.
It's a long day.
Yeah.
It started late last night, right?
Yeah, I'm like, all righty.
You'll notice it says this policy has not been adopted by any of our districts, and I believe, Caroline, that's because this is the policy that's substituting for some policies we're withdrawing, the ones on HIV/AIDS. Is that right? Is that this one?
That's right. Yes.
Yeah.
that's right.
So there was a policy on that. NHSBA realized that policy needed to be broadened, needed to spell out some additional procedures that have been put into place under state law. And so this essentially replaces those policies, which if this is adopted, will be withdrawn. Caroline, anything specific that you want to talk about on this one?
I don't think so. I think this one was, it was very relevant and helpful. And I'm happy to say that it, we're following this currently. So.
Thanks.
Yep.
Any questions, guys? Do I have a motion?
I'll make a motion to move policy. I'm sorry, I keep toggling back and forth here. EBCF to the school boards for a first read.
Thanks, Sharon.
Welcome.
I'll
I'll
second
second.
that. Thanks.
All right, any further discussion? A roll call, please.
Greg Parrish,
Yes.
Tom Von Jess,
Yes,
Mike Rabideau,
Yes,
Leslie LaFond,
Yes,
and Sharon Gordon.
Yes.
I have that vote recorded.
thank you. Next one, sample policy, EHAC, electronic digital records and signatures.
Yes, so, beginning in March, as most of you know, we very quickly accelerated into finding some ways to do a number of things electronically, not only including a number of hiring forms and business forms, but also when the state finally got around to allowing it, IEP, special education kinds of documents, et cetera. This policy catches up essentially to us being able to do a number of those things. Rhonda or Caroline, I'm not sure if there's something else I should be adding to that. Is there?
It's a brand new policy. I think you covered everything, and it's also alluded to in DAF, but I think they expanded on it when everything happened in the spring.
Yeah. Quite an expansion, yes. Caroline, remember the good old days back in April when we were debating whether parents were going to be able to sign IEPs electronically? Remember that?
That was,
Yes,
mhm. Right.
good one. It was a good one.
Yeah. Those seemed like such big problems at the time.
Such good times.
They did. I love it. All right, any,
I have a question, Bill. Page 2, item D, number 4. Forgive me, I don't know if we have this. Do we have a data governance and security plan?
We do.
Okay.
You adopted it when the law was put into place around making sure that our data was safe. We brought you that with Jason Saltmarsh. It was actually one of our first meetings with this group, and is in place, went through the board. So yes, you do.
Okay. Thank you.
any further discussion? All right, could I have a motion?
I'll make a motion to approve policy EHAC forward, or move policy EHAC forward to each school board for the first read.
I'll
Thank
second
you.
that.
Thank you. Any further discussion? Roll call, please.
Sharon Gordon,
Yes.
Leslie LaFond,
Yes,
Mike Rabideau,
Yes,
Tom Von Jess,
yes,
and Greg Parrish.
Yes.
I have that vote recorded.
thank you so much. Our next one is policy GCCBC, FMLA leave.
Yeah, so this policy really spells out what's in the Family Medical Leave Act in terms of people being able to access that under federal law. And Rhonda, was there? I know we have a couple boards that don't have this policy at all. A couple of boards that have
Correct.
older versions of this.
Correct.
Is there anything beyond?
The NHSBA just revised this in August, so this is, a lot of updates were added. And you're right, whenever we looked at it and realized how old it was and the fact that we had 2 districts that didn't even have a policy referring to this, we just felt that, it was kind of critical to make sure that, we brought this forward.
Thank you.
so obviously I support this. We need to be in compliance with federal law. My only question is, from my experience, there's a 26 work weeks of leave that folks are eligible for if they have a son, daughter, parent, next of kin that has injuries due to active service in the military. And that's not reflected in this. I'm not saying that we need to hold this up. Maybe if we just say the FMLA covers it, but we talk about the 12 weeks, but we don't talk about 26 weeks.
No, it's a good question, Tom.
Is that
Yeah,
the
why
same
don't-
leave or is that a different leave?
No, it's FMLA. It's under FMLA. There's
FMLA.
26 work weeks of leave during a single 12-month period for the care of a covered service member with serious injury or illness if the eligible employee is a service member's spouse, son, daughter, parent, or next of kin. It's part of FMLA, but under the military caregiver leave. Well, that's what it's called. It's military caregiver leave, but it's under FMLA. So again, not trying to gum this up.
No, you're not at all. Why don't, yeah, if you feel comfortable sending this forward, asking us to check out with NHSBA on that issue with respect to military, we can do that, and we can then add that if it's appropriate once we talk to them, and then advance it on the first read.
Okay. I'm happy to do that and to add the language in on the motion.
Yeah, if you want to send that to me, Tom, and then that way I can just forward that straight to Barrett at the NHSBA and let him know we would like to add this.
Okay, will do.
I have one question though. In the line that says employees should consult regulations that implement the act for more specific definitions and criteria for use, would we be covered that way?
We probably
part of
would.
the act?
We probably would. I think what Tom's saying is, given that we've been so specific, that they've been so specific in the recommended policy on some of these other things in terms of hours and those kinds of things, that seems like something that should be included there as well.
Okay.
So,
Okie doke. But I think if, like, to your point though, if we move this forward and God forbid it not get changed before, you know what I mean? I think the intent is
we
there.
can
There's
we can do that before we get to first reads. We'll have time to do that.
Well,
Yeah, thanks.
if something happened, we can still make sure that we're abiding by FMLA and law, even if it's not policy, right? We can.
Right.
Right.
Yep.
We're okay.
Okay, perfect. Thanks.
And none of these policies will appear on anybody's agendas until December. So we have time to, add that in there, run that by legal and everything.
Okay, thanks.
Bill, is this tied into the teacher's contract at all, or do we need to have it tied in, or is this just our position regarding our policy as a district?
The latter, Greg. FMLA is federal law. It doesn't need to be spelled out in their collective bargaining agreement.
Okay.
Any further discussion?
No, but I'd like to make a motion to approve policy GCCBC, FMLA leave, forward to each school board for a first read upon consulting the New Hampshire School Board Association on the Military Caregiver Leave Act.
Thank you.
I'll second that.
Any further discussion? Thank you for that. Can I have a roll call vote, please?
Okay. Who was the second on that? I was filling in the.
I was Ron. Greg.
Okay, thank you. Okay, I have Greg,
Yes.
Tom,
Yes.
Mike,
Yes.
Leslie,
Yes.
and Sharon.
Yes.
That vote is recorded.
Thank you. Our next one is Jlcb, immunization of students.
Yes. Caroline, do you want to speak to this? This is another one of the policies that we worked with the nurses on after NHSBA had a review with the Nurses Association.
That's right. And this is the one they were the most happy about. The two districts did not have this, which was surprising to me, to require immunization. So it requires districts to follow the DHHS, New Hampshire DHHS immunization requirements, unless exempted for medical or religious reasons. There are a couple conditional enrollment pieces here. And then students experiencing homelessness or unaccompanied youth, this won't be a barrier for them to enroll in school. The homeless liaison will work with the student and family to obtain the documents or examinations to get those immunizations without excluding them from school.
Any questions, guys? If not, I'll entertain a motion.
I'll make a motion to move policy JLCB forward to the school boards for a first read.
Thank
I'll
you.
second that.
Thank you. And a roll call, please.
Greg Parrish,
Yes.
Tom Von Jess,
Yes.
Mike Rabideau,
Yes.
Leslie LaFawn,
Yes.
and Sharon Gordon.
Yes.
I have that vote recorded.
Great. All right, I'm gonna scratch first. Next policy is, sorry, I just literally read it and had to do it. So, our next policy is Jlcc, head lice.
Yes. Yeah, I'm Caroline, I'm turning this over to you because I made it clear to Leslie this afternoon that I couldn't get through this without
I
scratching.
can't-
So,
yeah. I can't.
yeah, so
I had a feeling this was gonna
Yeah.
be on
Yep.
here. So, let's see, the key points of this policy is, it outlines when nurses check students' heads for nits and for live lice and when they do not. So, this was definitely approved by the National Association of School Nurses, CDC, and the New Hampshire School Nurse Association, in that school-wide screening for nits is not necessarily a way to prevent the spread of lice in schools among students. There are some equity issues with some of that. So that's a really important piece with this, this is not a policy to say that we're going to be implementing school-wide head checks. That's not happening. And let's see, and then it does have the management of the day of diagnosis. So if a student is found to have nits or live lice, when the student, this says when the principal and when the school nurse will notify the parent. And then also on page 2, the criteria for return to school. But an important distinction here is that the nurse is not going to instantly send someone home for nits or live lice, but there is a criteria for returning to school if there's live lice.
Right.
Happy
Any
to
questions?
entertain any questions if I can.
Look at him. I gotcha.
Not sure if I can answer.
I'm
So I don't want to be nitpicky.
Oh, you did.
So and then
Bam!
I wanted to work that in here, but I do have a serious question. So it does say this is when a nurse can check is if they're displaying symptoms. It does say the student can stay in class if they're comfortable. It does say this is when a student can return, but I don't see anything in here about saying, and maybe I'm just missing it, keep the student home.
So criteria for returning to school. So they would not be able to return to school unless there was treatment for live lice. On page 2, I believe.
Yeah, so I can see that when they can return, but it's just a little contradictory because if they're on page 1, it says if they're comfortable, they can stay in class.
Oh, I see. I think that's,
Say like you have to have them leave school or not return to school. It says they can stay in class and they can come back.
let's see here.
I think that's just if they have nits, they can't have live and stay in class. So that's just saying if they have nits and they're comfortable, they can stay in class. But if they have live lice, they can't. That's how I understand that.
Okay. Like I said, if this is all approved and everyone's good with it, I'm not trying to gum it up. It doesn't really say to me if someone has live lice, they need to leave school.
You're right. I agree. It doesn't spell it out.
So I think it's at the moment that the student is diagnosed that the student may remain in class. I think that's what that piece is about. And then the criteria for coming back. So what the nurses were strong about was that they're not going to be calling the parent at 9 a.m. if they're seeing, nits on the students. And if the student feels okay with it, they can stay in class.
Tom, I interpret that by the heading of that second section, which says the management on the day of the diagnosis. And that's where I see that they can stay if they're comfortable.
I see. Yeah.
Yep. No, I got it. I got that they can stay if they're comfortable. And again, I'm not pressing on this. It just doesn't say.
Yep.
It talks about returning, but it doesn't talk about needing to stay out until it's under control.
Just
Right.
from what I've seen sitting in my chair over the years that I've been here, that they're not allowed, I don't think they can tell them that they have to go home.
They can't be sent home with lice? No, huh? Okay.
Then I don't know that you can have criteria for return to school either. If you can't ask them to leave, and listen, we don't need to get jammed up on this. If the nurses are all fine with it, I'm fine too. It seems inconsistent to me.
Caroline, do you want to revisit this with the nurses
I'm happy to.
to satisfy that question?
Sure.
All right, so we want to hold off on this one?
We'll hold off.
Okay. Yeah, I agree. It doesn't, if you can't send them home with it, then how do you regulate them coming back without it, right?
Yeah, we'll review that with them.
Okay. All right, so we'll pass on that one. Our next one is Jlcg, exclusion of students who present a hazard.
And Caroline, I think this is the last of the policies that we reviewed with the nurses.
Pulling that up here.
Has to do with students who are excluded with symptoms of contagious or communicable diseases,
That's right. And
mental illnesses.
I think this also pertains to the withdrawal of the HIV
Yes,
policies
yes.
that we mentioned
Yeah.
before.
Right.
Mhm.
So this is when a superintendent can exclude a student. And when they cannot. So they cite IDEA, Individuals with Disabilities Act here.
Okay.
Can't exclude students based on disability.
Gotcha. So it can't be a disability, but if they have a communicable disease that could pose a threat to others, the superintendent has the authority to ask them to stay out of school. Roger.
That's right.
Any other questions? I'll entertain a motion.
A motion to move policy Jlcg forward to each school board for first read.
Second.
Second.
Any discussion? Roll call, please.
Greg Parrish,
Yes.
Tom Von Jess,
Yes.
Mike Rabideau,
Yes.
Leslie LaFawn,
Yes.
and Sharon Gordon.
Yes.
I have that vote recorded.
Thank you very much. Our next one is KE Public Complaints.
Yeah, Rhonda, I think if I'm remembering this correctly, these two also came out of the work that Barrett and Will did. Yeah. Okay.
Absolutely.
You want to say a word about them then?
In their work sessions that they had with all of you in individual boards, they referred to these and what the process was. And I had a couple members during a meeting ask me, and so I had sent the letters in the chat, and then I soon realized that everybody's was so different and they weren't up to date again. So when we looked at that further and realized that the NHSBA, even though theirs is an older version, it's still a newer version than what any of the districts had currently had in place. And knowing that it was an issue with the work session, something that they felt was important to draw out, we felt it was important to bring it to you guys to update your own policies.
Any questions? All right, I'll entertain a motion.
I'll make that motion to forward to the school board's policy KE for public complaints.
I'll second.
Thank you. Any further discussion? Hearing none, could we have a roll call, please?
Greg Parrish,
Yes.
Tom Von Jess,
Yes.
Mike Rabideau,
Yes.
Leslie LaFawn,
Yes.
and Sharon Gordon.
Yes.
I have that vote recorded.
Thank you. Our next one is KEB, public complaints about school personnel, employees, students, or administrators.
similar explanation to what Rhonda just
Right.
provided came out of those discussions and really lays out if the complaints are specific to personnel.
Anybody have any questions on it?
Well, yeah, actually I do.
Okay.
Shouldn't their first stop be to the principal, Bill, rather than yourself or the
Yes.
superintendent?
Yes, and that's I mean, that's my part of the procedure, right? That's what we do. In other states, they sometimes, Greg, have a chain of command policy. This spells that out in a slightly different way, but yes, if those get referred back to the superintendent, those conversations get referred to, have you talked to the teacher? Have you talked to the principal? Have you done those kinds of things before we talk? Yes.
Yeah, I mean, you should be the last resort, if you will, for something like this.
Just prior to the board, that's right, yes.
Yeah.
And Greg,
Okay.
that's, your question really is, sorry, but it's outlined in KE, public complaints.
Yeah.
It starts out that way. This is what it's, I believe KEB builds upon that and when it's went further.
Okay, that answers the question. I did notice that hierarchy
Mhm.
in the first paragraph there of the previous policy. Okay, that answers it. Thank you.
You're welcome.
Great, thanks.
Anything else? Then I'll take a motion.
I'll make a motion to move policy KEB forward to each school board for first read.
I have a second.
Second,
Thank you. Any further discussion? Hearing none, roll call, please.
Karen Gordon,
Yes.
Leslie LaFawn,
Yes.
Mike Rabideau,
Yes,
Tom Von Jess,
yes,
and Greg Parrish.
Yes.
I have that vote recorded.
Thank you. So our next ones are policies for withdrawal. So I guess my question is, do we just, you want to go through each one of these because they've already been discussed with what we've added in, or do you want to just go through them each one?
I don't think
I'm sorry.
no, go ahead.
So the motion says we batch them together because they've already been discussed above.
Right.
So I'd like to make a motion to recommend the withdrawals of policies GBAA, JBAA, GBGAA, including GBGAA-E and GBGAB, JLCC, and JLCCA, per the recommendation of the New Hampshire School Board Association.
and
I'll-
XYZ.
I will second that.
Don't you want to say what it is, Greg? Do you want to second? What are you seconding, Greg? You want to
Yeah.
repeat that?
Yes, I am.
I will never write another motion the same way, Tom.
Nope.
That was-
Think of you.
Discussion, guys. Other
was
than I think we just made a song out of it, but yeah. Any other? Okay. Anybody? No. All right. Roll
Yeah.
call, please.
Greg Parrish,
Yes.
Tom Von Jess,
Yes,
Mike Rabideau,
Yes,
Leslie LaFawn,
Sure. Yes.
and Sharon Gordon.
Yes.
I have that vote recorded.
Super. Thank you so much. And Tom, thank you. You did that beautifully. So yeah,
I've been practicing.
I like it. All right. Next one. Joint board policies. A-6 joint board bylaws.
So we've been working away at these a little bit as well. So A6, our attempt here was to, we did some work the last time we were together, and it's at the board level now, on superintendent evaluation and various committees, standing committees, and committees appointed from time to time. What we've done here is made the joint board bylaws policy consistent with those others that are in the process of being adopted. So it speaks to the operations committee, the policy committee, which didn't exist when this was created, negotiations, made it a little bit more specific, and then removed those pieces that spoke to an old superintendent evaluation process.
Okay. Any questions? All right.
I'll make that motion if you need it.
Oh, actually, do we have to do it all together?
You know what? No, I'm looking at this and realizing that I did not update the motion to be
Okay.
accurate. I had a consent motion in there.
Okay.
So, and then there was some other policies that were going to require a little more work that I didn't remove from the motion.
Okay.
So I'm editing this as we speak.
All right. I'm sorry, Tom, but you can't do a repeat. You can't, give us all of those at once again. Sorry. I know you practiced all night for it though, so. All right. Can we have a motion on just the A6? And do you want A6 and A7 together?
That's up to you guys.
Let's do it one at a time. Let's do the A6.
Okay.
I'll make the motion for A6 to be sent to the various boards, which regarding SAU 21 joint board policy.
For first read.
First read, correct.
I'll second.
Any further discussion? Hearing none, roll call.
Mike Rabideau,
Whoop, yes.
Tom Von Jess,
Yes.
Aaron Gordon,
Yes.
Greg Parrish,
Yes.
and Leslie LaFawn.
Yes.
I have that vote recorded.
Thank you. Next one is A7, public comment and participation at board meetings.
Last one of the night. So what we've done here is mirrored that public comment and participation policy for the joint board policy manual. So this is just simply what you recommended earlier for each of the boards to apply that language, that same language to the joint board.
Any further questions on it? Hearing none, can I have a motion, please?
Motion to move SAU 21 joint board policies A-7 forward to each school board for first read.
In a second.
Second it?
Thank you. Any further discussion? Roll call, please.
Greg Parrish,
Yes.
Tom Von Jess,
Yes.
Mike Rabideau,
Yes.
Leslie LaFawn,
Yes.
and Sharon Gordon.
Yes.
I have that vote recorded.
Thank you.
Hey, Leslie? Are you on mute?
Leslie, yeah, we don't hear you.
Are you there?
Yep.
Yes.
Leslie, I'd like to make a motion to adjourn.
I would love to hear a second for that. Yay.
I'll second that.
All right.
Thanks,
Third.
guys. Appreciate
Thank you
it.
very much. That was a
Thanks,
lot. We
everybody.
really appreciate it. Thanks.
Thank you.
Have a
That
good
was
one.
awesome. Thank
Bye-bye.
you. Night.
Bye.